Hello, my name is Levi Moore, and welcome to Community Pulse. Community Pulse is a public affairs show on CAN TV about public health in Chicago. And today, our guest is Kimberly Hobson, the CEO of, let me get this right, the Southside Healthy Community Organization.
Absolutely.
Kimberly, pleased to meet you.
Nice to meet you.
Okay. Now, I have to do a little housekeeping first. Okay. Community Pulse is an outreach and an education initiative by the Fox Glove Alliance. The Fox Glove Alliance is a coalition of 15 public health care organizations in Chicago, and it's sponsored by the Hectone Institute of Medicine, who I work for. And Hectone has been around for actually more than 80 years. And it's a not-for-profit that primarily manages medical research and public health care delivery grants. And among other things, it sponsors this show, and it sponsors the program for my other co-host. We rotate to Cora Love, who is the lead for Hectone's Nurses and Humanities program, and they actually have a dual role. They're also the Chicago chapter of the Academy of Medical and Surgical Nurses. So we're doing this a little bit different this year. This is our first show of the year. And in the past, we've done 2 shows a month, and there have been 3 rotating hosts. But, time. So our third co-host, the wonderful Megan Phillip, the Executive Director of Healthcare Council of Chicago, time just could not do it. So we decided, let's continue to do it, just be myself and Takora, and we'll do 1 show a month, and we think it's going to be a great year. So with that housekeeping out of the way, this is going to be a little bit different for me, because pretty much every guest I've ever interviewed on here I already knew. So I'm going to learn about you just like our guests are. So first, before we get into your organization, who are you? Tell us, where are you from? What was your path? How did you get to become in this position?
Yeah. Well, Levi, it's so nice to meet you as well. I didn't know Levi, but it's been great the 10 minutes that we've known each other, and thank you so much. My name is Kimberly Hobson. I am currently the CEO of the Southside Healthy Community Organization. I am a native of the South Side of Chicago.
Oh, okay.
Went to high school, born and raised on the South Side. Very excited about that. Auburn Gresham is where I grew up. My 3 adult children, my 3 grandchildren, all live on the South Side of Chicago.
Oh, wow.
And so this work is passion for me.
Mm-hmm.
And so I went to school on the South Side, started my healthcare career with Advocate Healthcare and Humana. I've worked at Advocate, I've worked at Humana, I've worked at University of Chicago for 17 years. That's been my longest tenure in healthcare. And so I've worked the entire spectrum of healthcare on the South Side of Chicago. And so I know healthcare in and out. On the primary care side, on the community hospital side, on the academic medical center side, on the provider side. I've worked for managed care organizations. So this is a passion for me, and I'm so excited to be here. Great.
Now, I just finished reading a book, and it was about this evolution that is going to be forced on us in healthcare. And I guess since the 60s or 70s, the model has been pretty much you wait till you get sick, you go to the hospital, or you go to a clinic, and the quality is going to be dependent on what kind of insurance do you have or whether you do have insurance. And your model is, what you do is different. And actually it was kind of funny when I was going on. It's like, that's what they're talking about, how we should go further. So.
Yeah. What we're doing in our model, and I'll tell you about it, it's called our Healthy Community Model. And so what we're really here to do, we're a nonprofit organization. We're funded by the state of Illinois, and we were created to address and close the health equity gap on the South Side of Chicago, and to begin to do that. And so we developed a model called the Southside Healthy Community Model. And what that has done is we've brought together 13 healthcare organizations on the South Side of Chicago, which which is 15 zip codes, and that is as stated by the city of Chicago. 15 zip codes. All of these healthcare organizations have come together to develop this healthy community model, agreed to do the same type of consistent work across the South Side, and we believe that is the impact. And so care coordination is the real impact.
Well, you know, one thing, and we were chatting up there, is like I just kind of infiltrated public health like 8 years ago. And I never realized that a lot of times the health systems and facilities looked at each other as competitors.
Yeah.
And so you've been able to sort of get them to work together, which is a great achievement.
Yeah.
Alone.
Yeah. When you have competitors sitting all in one room, which is what we have. We started this particular work, Levi, about 3 years ago. This is our 4th year with the Southside Healthy Community Organization. But prior to that, I worked at University of Chicago for 17 years. And we actually had an organization that was somewhat like this one, and it was called the Southside Healthcare Collaborative. It was started by Michelle Obama in 2005. And so that was the beginning of pulling all of these healthcare providers on the South Side of Chicago to work together. And so we did that work for quite a long time. But now that there's a Southside Healthy Community Organization, we have brought some of those same partners together, plus some additional partners, to be able to work together. And the reason I believe we've been successful in this is really getting everyone to agree to work on the real things that we all say we want to do to improve the outcomes on the South Side of Chicago. So we always tell them there's enough patients to go all the way around, right? But we have to make sure that we are meeting the needs of all 13 of those partners, and they all have input in terms of the way that we do things. We meet regularly, we have a governance structure, and we know that although we're operating together, we're also running our own organization. So it's meeting the needs across the board.
Yeah, so I only had 2, but I know that one of the issues that pops up in over like Cook County is that other systems will actually give them their charitable care, the people that don't have any insurance. And just from profitability, you're a not-for-profit, you still have to, pay the utility bill.
Sure.
So it's fascinating to be able to get them to work. Now, you only work with either Medicaid or uninsured.
Uninsured. That's the population that we serve. Yes.
And a lot of people, believe it or not, a lot of people shockingly who work in healthcare, they thought that after ACA, Obamacare, that, there aren't any uninsured people anymore. And there are, what percentage of, just the mix of it?
Yeah, you know what? I don't know that I know the exact mix. What I do know is that there's about 900,000 residents on the South Side of Chicago. And believe it or not, about 400,000 of those patients, those residents on the South Side, are Medicaid patients. And there is a percentage of patients and residents that are out there that are still uninsured. My staff runs into uninsured patients on a regular basis as we're in the emergency departments, in the federally qualified health centers, in the ambulatory care centers. There are uninsured patients out there.
So they don't have a GP, so they're going to the emergency room.
Yes.
Okay. Now, it looked like you have a big emphasis on preventive care.
Yeah.
So you go over that a little bit more.
Yeah. Well, where it all starts is seeing your primary care provider. The primary care provider is really where your health care is navigated through that particular provider. But we have a lot of individuals that utilize the emergency room for their primary care. Yeah. So they don't think about their health care until they get sick. And then they go to the emergency room. But when you're in the emergency room, you get episodic care. And so, you get this piece of care, and tomorrow they come back, or a week later you go back and your leg is hurting and they treat the leg. But when you go to your primary care provider, they look at the entire person and they're navigating you, not just to one thing that is ailing you maybe, but they're looking at you holistically and addressing your needs holistically. And so my staff, our community health workers and our nurse care coordinators that are deployed into 21 healthcare sites across the south side of Chicago, and they're in the community, on the ground, talking to patients in churches and on the street and knocking on doors when we can't find people. And what they actually do is they're working with individuals to share information about how to navigate that healthcare system. And one of the first things we do is we assess them, find out who their primary care physician is if they don't know, and we make appointments and make sure they even get there. So far, we've made 1,500 connections to primary care providers and made sure that individuals are getting to those appointments with free transportation.
Because, the first time I heard about it, got involved in this, Hectone was actually doing a lot of work for Cook County to help set up these kind of decentralized assistance hubs. And I remember I was talking to a congressional person, I won't name it, like, you know what? That was a really good idea. You all need to keep funding that because it really worked. We see that there were people that hadn't really utilized GPs, who finally started to.
Yeah.
But now you have a couple of, one thing I thought was interesting, that you also are involved with mental health too.
Mm-hmm. Yes. So we have, what we've done is we look at these care models, and we know some of the prominent ailments that are plaguing the south side of Chicago and so forth. And behavioral health is one of those. And so one of the things we did is we built a care model. And of course, all of this is still being scaled, but we built a care model. And we know Sinai is one of our partners. They have a hospital on the south side of Chicago, which is Holy Cross. And so Sinai decided to partner with us on our behavioral health work. And so what they've done is we subsidize the provider salaries, but they have psychiatrists, psychologists, and so forth that work with our health centers to provide behavioral health services to our residents.
Right. And then there was another one that really stuck out, maternal health.
Maternal health is really, really big. So expectant mothers, we really want to make sure that they have this holistic program that they're a part of. We want to make sure that they know they're expecting, but we want them to have all that they need to be well and get through that pregnancy. And so we've developed a model by which it's an academic medical center. There's a federally qualified health center, and we are getting them all of the things that they need and subsidizing this. We've got an ultrasound machine there. We've got a maternal fetal medicine for high-risk moms. And so we're putting all of the things that is needed to keep this mother healthy. We're putting them all at one location, so they're not going here for ultrasound, there for specialty care.
Yeah.
We're getting it all there together, making sure they not only have clinical care, but they also have their social resources met, like food and transportation and all of those things and housing. And then we also have a program in place for fathers. And so fatherhood services is a critical part of our maternal health service.
I have never heard of anyone doing father. It's needed.
Yeah, it's totally needed because the mother doesn't have the baby by herself.
Yeah.
So the father, just like you're working with the mother and getting her everything that she needs and helping her to address the issues that she has with concerns around being a mom, where there's a dad there too. And so that rounds out the family and gives the services that is needed for them to serve well. And then we serve them for a year after the baby is born.
It'll be interesting because all of these things are popping about disparities with pregnant women and young mothers, and the disparities are they're impacting Black women. Well, we don't know why. But it'll be interesting to see what your numbers look like, the impact that you've had once they've had time to seep in. And it's kind of funny. I've been sitting here and it's like, okay, I'm just thinking about Fox Global Alliance members. And the Illinois Association of Free and Charitable Clinics is a member. And access to care which is they kind of help people get access to health services in suburban Cook. And I'm actually on the chair of the anchor committee for Westside United. I said, boy, they're coming close to doing a lot of what, Westside United's approach is attacking social determinants of health. Mm-hmm. Food security, job security, and I thought that didn't you do some work in terms of housing?
Oh yeah.
Yeah.
Oh yeah. So we have a housing program, and we have done some funding through the flexible housing pool.
Okay.
And so we have housed right now about 82 or so patients, and residents, I should say, and they're actually getting into housing. We have people that are in housing, and they work together with them to make sure they stay there.
What is the flexible housing pool?
The flexible housing pool is a program that is through the state, the city of Chicago, and different organizations like myself and others actually put money into the pool, the flexible housing pool, and it's a program by which they not just take individuals and put them in housing, but then they have programs within a 3-year period of time to make sure they have a work and make sure they understand how to manage their lives so that within that 3-year period, they will be ready to stay in that housing and be able to maintain adequate housing for themselves. And so the SSHCO, or the Southside Healthy Community Organization, funded 95 slots for residents on the south side of Chicago to get housing for up to 3 years.
And I'm starting to see why this is working, because a lot of times people don't know that certain programs exist.
That's right.
And I'm just going back to when I worked in government, we would get appropriations to do these programs where we had no money to market them.
Yeah.
And it's like, okay, we have this great new loan program, but if no one knows about it, a year from now, you'd ask us, how did it go? Like, not that well.
Yeah. Let me say, this is how I will respond to that. When you think about the fact that there's all of these programs out there that people may or may not know about. What are the award we receive from the state, which is allowing us to function right now? It is allowing us to bring all of the things that are needed to create wellness for individuals, Levi. Yeah. Because only about 20 to 30% of a person's wellness is healthcare proper.
Yeah.
The other 60 to 80% is whether or not their social needs are met. And so being able to bring all of that together and raise awareness about what is available in the community, that is what's key.
Now, this is sort of the wave. One of the few good things that came out of the pandemic, telehealth. Yeah. So how are you incorporating telehealth?
Our behavioral health program is telehealth.
Oh.
Yeah, so we have psychiatrists and psychologists from Sinai. The clinic that we started with was Chicago Family Health Center. Chicago Family Health Center sits there. We have a whole process by which they identify individuals, because our goal is to try to get individuals before they're having crisis or before they're in crisis. And they can either do it from home, or they will put them in a room at the clinic, and they can actually have their visit that way. The reason that Sinai is our partner is because they've been doing this for many, many years, and they've been pretty successful at doing this telehealth. Yeah,
because it's sort of like, okay, well, personally, my last visit with my doctor was telehealth. It was a phone call. Yeah.
I've had the video one, so it really works.
Yeah. I got a question for you, because it's not just healthcare, it's everything. How are the hospital centers you're working with and your organization, how are you doing with the workforce shortage?
Yeah. So with workforce development, what part of our grant that we receive from the state, our agreement says that we really have to address workforce development by hiring individuals. A large percentage of the individuals that we hire, our community health workers, our nurse care coordinators, our vendors that we hire to assist us in specific areas, they have to be people of color
Okay.
live on the south side of Chicago, a certain percentage of them. And so we've been able to upskill individuals that many of them, and they become community health workers
Okay.
perhaps, and they may not have ever worked before. And so we're not just doing the hard skills of
Soft
teaching them how to
skills.
do that, we're teaching them that, when you work, you've got to come to work every day. You've got to be able to understand the computer. So a lot of times we've got to give those computer skills and all of those things, because it's a different type of training. A lot of our staff is not coming in with all of these things, but a big part of our work, and we've got a grant or so to help us with this,
Okay.
is to deal with the specific skills, but also deal with the self skills and build our workforce that way.
Yeah, because there's another FOSCO event, it's the Chicago Healthcare Workforce Collaborative. And one of the things they've realized with their Youth Pathways program is that, okay, you have a lot of young people out there, they don't know anyone who's had a career. It's totally foreign. They may know some people that have a job or in this gig economy. But when you're talking about stuff like, just to build that long-term perspective of, okay, if I do this, then I'll be stuck doing this for the rest of my life. No, you can move up and up. And it was interesting because in some of those meetings, I didn't realize that because of the pandemic, when you had looked at me like, oh, we have this huge shortage of nurses, they had never looked at developing career paths for their nurses to move up. And now, they were forced to.
Yeah.
Now, I realized something too. You started right when the pandemic was waning down.
Yes. Absolutely.
That had to just, because we were all shell-shocked. And I know I've told friends, you remember how things were so? It was like, no, we were all locked up in our homes 4.5 years ago.
That's right. We started in 2022 is when we started receiving our funding from the state of Illinois. I joined the organization in May of 2022. And so I tell you, we were coming off of COVID and trying to get everybody back into the fold. But we're moving along now, and I tell you, we're really making headway.
Yeah, no, because they're still trying to assess the damage of what that did to people's mental health.
Yeah.
Because I remember I was actually coming to work, and the driver had NPR, and there was a story about how it didn't matter what your zip code was. Kids all over Illinois were just acting up in school.
Yeah.
And no one knew why. It's like, okay, pandemic, parents tense, inadvertently passing along, then the kids get tense. And I think I know a lot of people were trying to forget the hope that the pandemic existed, but the damage is still there and needs to be repaired.
Yeah, I think you're absolutely right. I have 3 grandsons that live on the south side of Chicago and go to the Chicago public school system. And I also have a son that's a dean at Butler Career Academy right here on the south side. And so he sees these things, and I see those things continuously. So I don't think that the mental health or the behavioral health issues that we may have all suffered, not just them, but us as well, is gone away. I think it's going to take lots more time to get our kids and to get ourselves where we need to be.
Okay, I know we're coming short on time. So, are there any last messages you have? And then how, if I want to work for you or want to try to access your services, how would I do that?
I would say that if you want to access the services of the Southside Healthy Community Organization, you can visit our website at southsidehealthycommunity.com, and we can serve you there. You can send an email, you can fill out a form, you can tell us what it is that you're interested in, and someone will certainly return your call.
Okay, and any events, initiatives coming up that you might want to promote?
No specific. Well, I'll put it like this. We have an empowerment health fair every year, and that will be June 28th, so stay tuned. We're starting to plan for that now. I would like to say that if you're Medicaid, if you're uninsured, reach out to the Southside Healthy Community Organization. We can connect you with social services. We can connect you with a primary care provider, get you into specialty care. We can provide you with transportation to and from your health care appointments. We can do all of those things. Get you some free food. Get you workforce development training. We can do all of those things. And our ultimate goal is to improve health outcomes on the south side of Chicago and to close the health equity gap that we have right here within the 15 zip codes of the South Side.
Okay, it's time to wrap up. Kimberly Hobson, it was a pleasure to meet you.
Thank you so much for having me.
And when I looked at your LinkedIn, I was like, you know what? Why have we met already? It's like we know a bunch of the same people.
That's right.
So once again, I'm Levi Moore, one of the rotating co-hosts for Community Pulse. And next month, you'll see the other co-hosts, Decora Love. And thank you for joining us.